But to be honest with you, I was really sick. I was miserable. I couldn't lie down. Felt like an elephant was sitting on my chest if I lied down, but I couldn't really get up and do anything because I had so much fatigue. So I basically sat in a chair, and it felt like there was a little man inside my chest with a hammer, just like hammering on my chest wall, every single heartbeat. And so you can imagine, as the days and the months went on, like it was torture. And I know people use the term traumatic a lot, but it really truly was a very traumatic event for me.
Welcome back to Being in Medicine. Thank you guys for listening. We're excited to have Lindsey Miskin with us today. She is a phenomenal nurse and coach and works with patients on chronic pain and symptoms. And we're just excited to have her here. So thanks, Lindsey, for being on today.
Oh, thank you for having me. I'm super excited to be here.
Yeah. Well, we're excited. We've gotten to know you and have had many conversations, and we're just excited to share your story and share what you do with folks. And so, when we've talked before, you've been telling us a story about how your own health experience and what you journeyed through as a patient that brought you into the career that you do now in terms of helping folks with chronic pain. Tell us about the story. Tell us what went through life for you and what brought you here.
Yeah, my story is probably similar to many mind-body practitioners who kind of come to this work with their own experiences. So I'm an RN. I've been an RN for about 15 years. And in 2022, I was just in a spin class. I had recently had a COVID infection, but was doing fine. And all of a sudden got heart attack symptoms, sharp chest pain, shortness of breath. So I hopped off my bike, went right to the emergency room. Didn't have a heart attack. After various testing, they finally found that I had been diagnosed with what's called myopericarditis, which, for your listeners that aren't familiar, it's inflammation of the heart and the sac that is around the heart. Which is typically after a virus. So they attributed it to my COVID infection that I had a few weeks ago. They told me, it usually lasts 3 to 6 months, take it easy. And so I went home and tried to take it easy as much as one can when one has 4 kids under 10, I think at that time. But to be honest with you, I was really sick. I was miserable. I couldn't lie down. Felt like an elephant was sitting on my chest if I lied down, but I couldn't really get up and do anything because I had so much fatigue. So I basically sat in a chair, and it felt like there was a little man inside my chest with a hammer, just like hammering on my chest wall, every single heartbeat. And so you can imagine, as the days and the months went on, like it was torture. And I know people use the term traumatic a lot, but it really truly was a very traumatic event for me. And so I just kept looking forward to that 3 to 6 month mark where I would be feeling better. Right. And in the meantime, just living in total chaos because we didn't have a lot of family who lived in the area. My husband was working a lot of hours. My kids were like, they didn't know what was going on. They were scared. They thought I was going to die. I thought I was going to die for a little while too, to be honest. But anyway, very stressful environment. And the months went on, 6 months, 7 months, 12 months, 18 months went on, and I was not getting better. However, my scans were now clean at this point. The inflammation had died down, and I was so confused because I was so sick still. Yeah. And and at this point I had actually started developing other symptoms as well. Like I would get really dizzy. I had really intense neck pain, digestive issues, unexplained rashes. Like basically my body was falling apart, and I would go to doctor after doctor, and my labs are clear, my scans are normal, and I just didn't have any answers for me. So that was a pretty dark time. I was pretty much couch ridden for about 2 years. And then I got to the point where I had expended every avenue as far as the medical route went. And then I just happened to, like a Google search had led up this app, which is called Curable, which is for people with chronic pain. And I was like so desperate. I'm like, buy it right there. So I bought the app, and it exposed me to a new way of a new concept of chronic pain that I had never heard before. As a nurse or in any of my training or any of education, was that oftentimes chronic pain and other chronic symptoms are actually the result of learned neural pathways rather than actual tissue damage.
Sure.
So meaning the brain is generating the symptoms. And to be honest, at first I was a little skeptical. I'm like, no, these symptoms are real. These symptoms are very real, but I had nothing else to do, right? So I dove in, and wouldn't you know, little by little, I got better. And so I was just, I was so floored that I was like, why aren't doctors, why aren't nurses aware of this? Like, why aren't we looking into this as an option when we are treating our patients? So I kind of just went into the rabbit hole of mind body medicine myself, went back to school, got a coaching certificate so that I can now help coach other people who have chronic pain and other chronic symptoms. And it's the best job ever. It's like so rewarding. And I've found like exactly what I want to do as a nurse.
Wow. What an amazing story. 2 years bedridden or couch ridden, as you said. Tell me a little bit about the work that you said you dove into it. What was that like? What was that like? What was the diving in aspect?
Well, at first it was definitely just really self-guided, self-taught. So I would just, if there was a doctor who was mentioned in, the app, I would go to their website and I would look at all their resources and watch podcasts about, what they do and how they treat their patients. There's quite a few books on the subject. I read them all. And then slowly I was like, you know what? I think I can help other people do this. So over the last year, I've been creating kind of a little bit of my own curriculum where I help. There's kind of 3 points that I work with my clients in helping them heal from chronic symptoms.
Yeah, tell us about those 3 points, if you would.
Yeah. So the first point that I always work with is re-regulating the nervous system. So typically, if you've been in pain for a long time, your nervous system is constantly in fight or flight. It's always looking for threats, and until you regulate that nervous system, you're going to have pain and you're going to have symptoms. So you have to reteach your brain that it's safe. So the ways that we do that, there's meditation and mindfulness practices, yoga. There's actually, to be honest, education is a really helpful tool in that one, because like I said, a lot of people just don't know that, when they get the diagnosis of fibromyalgia and they hear that there's really not a lot of hope for them, and they're in despair. But when they learn that actually fibromyalgia responds very well to mind-body treatment, and that, when the concept of, okay, so the brain's generating all these symptoms, that's why I'm having them. If I attend to what's going on up here, it gives them a little more hope. So that's the first one, is re-regulate the nervous system. That one's probably the hardest to do, because especially if someone's been in pain for a long time, it's just those neurons that wire together, right?
Yeah.
So we have to.
Can I just ask, when you started to do the work yourself, what was the timeline for you to start to really experience the benefit of that re-regulation that you were doing?
I would say probably 6 months, to be honest, where I was consistent in doing those things. And then I just had a click moment after about 6 months, where all of that work kind of like, I got it. I call that a shift point in my coaching, because my business is shift, mind body coaching, that when you get to this point where there's a big shift, where you are no longer afraid that your body is hurt, or there's something wrong, like your healing exponentially skyrockets after that shift point. So 6 months. I would say 3 months. I typically will have clients that see progress within about 3 months, but it's very different for everybody, to be honest.
And it's daily work that they put in.
Yeah, I would say, I'm 15 minutes a day probably is all that I would expect my clients to start with. I'm very about small, manageable goals. And so, yeah, so even 15 minutes a day over a couple months makes huge, huge difference.
Wow, that's amazing. And so then
Yeah.
the second pillar, tell us about the
Yes.
second part.
Okay. Second part is emotional awareness and expression. And so most of the clients that I work with, they have come from a home life or childhood, or maybe are in an environment right now where they're not emotionally safe, or they weren't emotionally safe, meaning it wasn't safe for them to feel those big emotions like anger and fear. And so over time, they learn to bury those or to avoid those. And so we work a lot with helping them reconnect what they're feeling. So I would say journaling is the best way that we do that. Consistent journaling every day, because journaling is a super safe place where you can get out all those ugly feelings. But you can see them, your brain can see them, it can process them, and then it can let them go so that they're not stuck in your body.
Yeah, absolutely. Yeah. And the third part, let's just jump to that one so then we can.
Yeah. And then the third one I say is excuse me, is self-compassion. And I know that sounds kind of, people are like, oh, like self-compassion, whatever, but you will really hinder your progress if you avoid this one. Self-compassion meaning you're extending the same kindness that you to yourself that you would extend to anyone else, like in a moment of weakness or vulnerability. Sometimes we are so hard on ourselves, then we never would be that hard on other people. So that includes our self-talk. It also includes just taking care of ourselves. Like, are you giving yourself enough sleep? Are you giving yourself enough time, the things that you need? And then in general, I would just say with self-compassion that the energy in which you do this work is as important as the work itself. So that if you're saying, well, I'm doing yoga 3 times a week and I'm meditating and I'm doing all these things, but there's this urgency and this desperation to get better, that really hinders your progress as well. So it's a lot about giving yourself grace. It's a lot about letting yourself mess up and learn and say, okay, next time I'm going to do this. And with those 3 pillars that I use, like I would say my clients, if they're willing and open, they all get better. And it's really, really, really exciting.
Yeah. Yeah, you did a great job outlining those 3 pillars that you use. And what I found in there is there's a lot of language that you speak that people have to learn to kind of understand what it is and how to recognize it. So you do
Absolutely.
a lot of education with your patients around the language that you guys use.
Oh yeah, absolutely. And I'm actually right now working on a workbook to go along with for my coaching clients, because there's just so much that, depending on, your history, your background, where you came from, so much of this is a completely second language to people that they've really never even talked about. And like, I've had clients, for example, with emotional awareness, where we talk about, where do we feel feelings in our body, and they can't tell you. So if you say, like, think about like what it feels like to be really afraid, like if you almost got in a near car accident, that feeling of your stomach dropping, or maybe your heart jumps up to your throat, those kind of things that we can all relate to. A lot of my clients, they can't recognize that at all. And so for them to be like, feel my feelings, I don't know how to do that. There's a lot of education and a lot of practice.
Yeah. So what does practice look like for most folks? Like, how do you help them settle into feeling their feelings? How do you go about doing that?
Yeah, it's probably the hardest part, to be honest, is helping them feel your feelings. And so there's many options. I'm one who's going to be honest and say that everybody's healing path will look a little different. So I'm not going to say, well, if you just did this, then you'll feel your feelings. A few ways that many people do have success feeling their feelings. I talked about journaling repetitively is one. Sometimes art or music expression is a better way that people have connecting with feelings, because if you're the type of brain that really responds to art or responds to music, and it can help evoke some of those feelings. So we're just like getting experience exposing us to those feelings, and like, oh, that's what fear feels like. Oh, that's what joy feels like. And so over time, those, like we said, those neural pathways build where we can recognize an emotion, and we don't need to have a physical symptom to tell us how we're feeling, because we can be aware of it.
Yeah, absolutely. And your experience that you went through as in your health journey, right, opened you up to this sort of work. How do you draw upon that to work with people now? How do you do that? How do you weave that together?
I would say, firstly, it gives me a ton of empathy, obviously, because I've myself been in a place, and I was in a place for a long time where if someone had come to me and said, there's this concept about your brain generating these symptoms, that I would not have been ready myself to do that work, that I would said, you're crazy. Like, I'm a nurse. I know all about, I've researched myopericarditis. I've seen every website on the internet about it. And so there was a time where I wasn't ready. And so part of working with clients is realizing that they have to be ready to do this work. And sometimes they're not. And I don't take it personally. It's just not their time yet.
Yeah.
And another thing that, drawing on my own experiences is, so in my situation, I started with a very structural issue, right? Myopericarditis is like a very structural issue that causes pain.
Right.
But then as time went on and I healed, the pain stayed. And I really did not make the connection of what was going on in my life and how that was attributing to my pain. So as now a nurse that coaches people, I can look back and I can see, they can tell me the things that are going on in your life. Mm-hmm. And I can ask them questions about the relationships. Tell me what it was like growing up in the home that you grew up. Tell me what it's like now. Do you feel like you have people in your life who support you? And so I can kind of make those connections for them quicker because I've been there myself.
Yeah, that's great. Jeff, what are your thoughts around questions for Lindsey around this?
Well, one thing is you painted that very vivid image when there was the structural problem going on of the guy with the pickaxe beating on your chest, or however you phrased it. And I can see that in my mind as you say it. I wonder about visualization and how that might perpetuate, and how visualization can be used in the solution, or if you use visualization.
Yeah. Good question.
Yeah, great question. I use visualization often. So that example that I gave you for what it felt like for me, I this whole time, in my mind, am picturing my heart on fire, right? Like I'm picturing it inflamed and it's rubbing, and the more I do, the worse it's going to get, and it's going to get irritated more. So that visualization was hurting me. And on the contrary, I do a lot of visualization exercises with people where we either visualize ourselves healing. So like, let's say I'm working with someone who's got back pain, where they are visualizing their body healing itself. Or there's even one that I do where we go into visualize going into the pain center in your brain and literally dialing down that pain signal.
Sure.
And this kind of work is not something that will happen 5 minutes later, doing that exercise one time. But I am confident that over time, if you keep those things up, you will see results.
I had another question for you. Thank you for that. That was brilliant. The self-compassion, and you phrased it like, how would we treat ourselves the way we would treat another? Where do you think that comes from, that we are harder on ourselves, our own negative self-talk? We say things to ourselves that we would never say to another person.
In my experience, a lot of it comes from how you were spoken to as a child, maybe by your parents or other coaches, people close to you. When you made a mistake, how did they speak to you? And it is really interesting that you would think sometimes that if you're learning that kind of talk, that you would talk to other people like that. But I really, oftentimes what that kind of talk to children does is it teaches them to hate themselves instead of to be that way to others. I wouldn't say it's always the case. It was not the case in my own life. I come from a really stable, loving family. And I was not, occasionally, we got in trouble. My parents got mad like any other normal family. But I think also it's very, if you're looking at productivity, sometimes it's effective. It's effective to speak to yourself that way because you can get a lot done when you've got a fire lit under you. But in the long run, it really doesn't help.
Thank you.
Yeah. Yeah. You have expressed a lot of getting to the root of the problem with folks in terms of self-compassion and re-regulating and emotional awareness. How do you show up for your clients? Who do you have to be to show up to create that space for them?
Yeah, that's what you guys do, right? Being in medicine, and I love that concept because that's I feel like that's what's so powerful about being able to coach people is I show up without an agenda, and I get to just be with them, and I just listen, and I'm not judging while I'm hearing things. And that is something that so many of us have never had before, to just have someone sit with you and listen and ask questions to understand. Right. So that's probably one thing that I would say is really, it's a gift to my clients that I work with, is oftentimes they go into a doctor and the doctor in their head they already know what's going on. They're like, oh, this person with chronic fatigue syndrome, like they think they know, or maybe they make assumptions about this person, why they are the way they are and why they're having these symptoms. So that's one thing that I say is really important for all providers, is to just challenge ourselves a little bit, go in without any judgment, which is hard to do sometimes.
Right. Yeah. To be open to hear what people are going to say, and to have enough presence about yourself to just be listening and listen to what is going on for people. That does take practice and take some intention for a fair amount of people.
Yeah. And I think another thing that is really important, which is really hard, I understand, for doctors and nurses, is that I have to take care of myself if I really want to show up for my clients. And so I practice what I preach. I'm a regular meditator. My body lets me know if I am doing too much, and I know I need to step back. Because of that, I have a policy that I don't coach more than 3 clients a day, because I know that in my life situation right now, what I can give to them, what I can give to myself, and what I can give to my kids, that number is 3. That if I would add another client in, that it would not be serving them the best that I could. And so I've kind of made that boundary for myself. And I think, doctors and nurses need to take care of themselves too, if they want to show up as the best providers that they can.
Yeah. Yeah. We've seen, as burnout in medicine and in healthcare kind of increases, and, the system just gets stretched thinner and thinner. We're reaching a point where we have to be mindful of taking care of ourselves. And I don't believe that we encourage that or activate that often enough. And Jeff, maybe you feel the same way, but I sense that when I'm moving around the hospital and the clinics and so forth. So
I think about how you take care of yourself, which is great. And when you work with a client and they re-regulate their nervous system and get in touch with their emotions and exercise self-compassion, that probably produces miracles outside of them and their families and their relationships. Have you witnessed that?
Yeah, that's what's so cool about this, is that, pain brings them to my doorstep, but when they leave, there's a complete transformation. Is that I like to say pain was the invitation. Pain is always an invitation in some way. And so they come in just thinking, I'm just going to work on the pain. Finding that the answer is, the problem was not the pain to begin with. And then you end up knowing yourself so much better and being so much more whole as a person when you walk away. That most people, believe it or not, say they were grateful for the pain because of what it taught them.
Wow.
That is a miracle right there.
That is a miracle. Yeah. That is for sure. Yeah. Have you worked with folks who have used these techniques, the mind-body aspect, prior to, I know Jeff had, Jeff, if I can share, you've done some work in this on yourself when you were the patient at one point. Have you worked with folks who have kind of set the stage mentally, mind-body wise, prior to having an experience in medicine? Like, say, getting a surgery, or get a total shoulder, total hip, total knee, something.
I honestly haven't, and I would love to work with someone like that. I don't know, Jeff, what was your experience?
Well, Corey just brought it up. I was to have a total shoulder, I had a worn out shoulder. It was a post-traumatic thing. Had a whole bunch of non-powerful thoughts around it, like I'm too young, it's not fair, what if something goes wrong, my livelihood depends on me working, and all the stuff. That I worked with a coach who helped me create more useful thoughts around the whole thing and go into it with a different experience of pain and how to, pain being a signal, pain not being a story, things like that. So I went into my surgery in a way that I just think it was amazing. It went great. And I would love to be able to work with people ahead of time for their surgeries to produce that same experience for them.
I'm just so impressed that you had the wisdom to see that and to work with a coach before, because I think so much of our thoughts really does, our thoughts become our feelings, or they determine our feelings. And so since emotions are so tied to chronic symptoms, to be able to catch those thoughts early and to change the narrative, I'm sure was super helpful for you.
Right.
Yeah. So, being in a traditional medicine and the traditional RN nursing role that you had leading up to this new career in a sort of way, if you could look back and give your old self some advice, what would it look like? What would that be?
Well, I would say that I probably was not a typical new grad, where all the new grads were so excited to go work in the hospital and do all these fun, really intense procedures. And I call myself a self-declared sleep snob. And so I was not about to work night shifts, and I was not about to give up my weekends. And so I've always kind of, gravitated toward roles where I was able to establish more of a relationship with a patient over a long period of time, rather than just like a 12-hour shift where I saw them out. So I've always kind of had a little more holistic mindset in nursing. But I think, like, if I could look back, and even with that mindset, if I could look back and tell myself something, it would be to take a step back still. Because sometimes we're just so focused on like documentation, and we just have to get in, make sure that we document everything that happened, and what medications we give, and all of those things, where sometimes the person gets lost in the patient, and so even for me, who was someone who always kind of was like that, I still kind of a little bit was like this mindset where I was hyper focused on the problem, not realizing how much every body system, how much they each connect with each other, and how much they each influence each other, and obviously the brain, the neurons that go everywhere in the body, right? So there's so much connection between our minds and our bodies. And for an example, which I'll give, is a pretty common one that I see is back pain, right? Where you're just hyper focusing on the back. And in acute cases, that's typically what you should do. You hurt your back, and but when the problem becomes chronic, and when the imaging shows nothing remarkable, and in the back I'll even say disc degeneration or disc bulging, there's really no correlation with chronic pain and those symptoms, to just take a step back and look at what else is going on and try and make those connections.
Yeah, take a step back, create some space, have some presence, and recognize what's in front of us. If you could, people who are working in that traditional healthcare setting where they're constantly busy, moving, doing all the different documentation requirements and those sorts of things, what do you say to those folks in terms of, take a step back, but how do you weave that into their daily work? Is there a way to kind of be more mindful that you would recommend?
For my particular with the clients that I work with, so let's say you're having, if you work with people who have chronic pain or chronic symptoms such as dizziness and vertigo is one that's not really pain, but it's a chronic condition, or chronic fatigue. I would say the best way that you can do that is to get curious. Sure. So I know you've got a lot going on, you've got a lot to chart, you've got other patients to see. Sometimes just asking a few curious questions will help will help you kind of make those connections with your patient about other things that are going on. And that's my suggestion for the providers who are maybe treating or seeing patients with chronic conditions where, you're rolling your eyes and thinking like, what can I possibly do for this patient in the next 20 minutes that I see them? Yeah. They've had back pain for 20 years. What can I do? Is to get curious and to ask them questions about their symptoms. And I don't think I haven't mentioned yet about the fit criteria. And that's kind of how I used to kind of diagnose, like, are these symptoms things that will work with mind-body problems? Are they brain-generated symptoms? Sure. And the fit criteria is developed by Dr. Schubiner, and he's a kind of leading guy in mind-body medicine. And fit stands for functional. So meaning, is it affecting function but not structure? So you're not seeing structural problems, but you're seeing functional problems. I being inconsistent. Is there inconsistencies with your symptoms? For example, does your back hurt all the time except for when you play golf because you love golf? My inconsistency in my own life was going on a cruise. So Jeff mentioned that at the beginning, that story. So my shift point was after we went on a family cruise. I was so nervous about this trip because I'm like, do I bring the wheelchair? There's going to be a lot of walking. There's going to be a lot of people. So we went on the ship, had a great time. I did not realize until driving home that I did not have any pain on that vacation. Wow. And it was kind of this like aha moment. I was like, I didn't have any pain. And as soon as I set foot in my door, my pain came right back. It's like I put on my comfortable pain that I was so used to. And that for me was my shift point where I was like, wait a second, if I've got structural heart damage from myocarditis, pericarditis, it doesn't turn on and off based on the location that I'm at. So that for me was like, oh, there's some inconsistency there. So that's I. And then T being triggered. So is there a trigger that causes your symptoms to flare up? Sometimes that's a really stressful emotion, right? Like if you're really angry about something and all of a sudden you get a migraine. Yeah. Sometimes that trigger is a person. I have a lot of people who struggle with they get pain whenever they're with their in-laws. Who knew, right? So asking those kind of questions, asking those fit questions, a lot of times that'll kind of set some bells and whistles off that you're like, you know what, I think you could really benefit from seeing a mind-body coach, or there's other providers in the country that do this kind of work as well. Wow, that's great. We work in, surgical realm. That's kind of our area. If we were to educate nurses, providers around the fit criteria as a quick assessment of the situation, and we say, oh yeah, this seems like a mind-body thing that's happening here. If I wanted to do something right then in that moment, not just refer them out, what would be the one thing that you would recommend that I do in the moment, maybe with that patient? Or is there anything that you would recommend that I do in the moment with that patient? A few things come to mind. I think actually, Jeff, I had sent you a YouTube video that's like a couple minutes, I think. There's a couple YouTube videos that I use that's just a couple minutes that explains the brain science behind the pain. So it's not, so when you're approaching clients or patients like this, I'll be honest, they can get very defensive if you are insinuating that their pain is not real, right? Or in their brain. I've encountered a lot of that. And so, that might happen. That still might happen no matter how you approach it. But I find when you approach it in education of the brain science is, the fact that, the brain creates a neural pathway, and then over time it reinforces and it makes a connection. I use the example of Pavlov's dogs a lot of times, if you're familiar with that, where Pavlov was a scientist who, he fed these dogs and he would ring a bell every time he fed them. And then he would measure the amount of saliva that the dogs, would salivate. And I don't know how he did that. I don't know how you collect saliva from a dog, but he did. Anyway, and so it got to the point where he could ring the bell without the dinner, and still make the dogs salivate because they had made that connection with that bell, right? So that salivating is a physical symptom, right? And there was an outside thing that was triggering it. The brain had made that connection, and that's the same. That's the same with pain. There is the brain has made a connection. It's very real. The pain is still very real. But when you approach it maybe with that, just like a couple sentences about, the brain science, that might maybe the defenses will come down a little bit so that your client can get thinking about, maybe that does really apply to me.
Yeah. Oh, that's great. I love that. What do you have to say about that, Jeff?
I think there's an indoctrinated story in medicine that brain-created pain is not real, like you alluded to a moment ago. We see it as not that way, to the point where it's even judgmental. We even have a term for it. Yeah. Like, this is a supratentorial problem, not a physiologic problem. And I think since what we're talking about right now is being in medicine, if I can be with a patient, or we can be with a patient in a way that we show up, we're not being judgmental.
Right.
Something wrong with that. It's real. I mean, you're still having the experience. So if they experience me as being judgmental around it, there's more likely to put up a defensive reaction rather than experiencing me as being compassionate around it, and let's look for a solution.
Right.
I love that. And actually, that's probably what I would add is believe them. That's what you could do when you're in that situation with them, because a lot of times they don't feel believed, and that can probably be the biggest thing, is when you show up and you say, I believe that this is real, this pain is real, and I believe that you're hurting, and empathize with them a little bit. You probably will get a lot further.
Yeah, absolutely. What areas would you say, well, how about I reframe it this way? Do you feel like we educate people around this enough in traditional medicine?
Not at all. Not at all. Like I said, I think that if it's ever talked about, there is this judgmental, like, dismissive attitude. These people are crazy, right? Yeah. And to be honest, the work that I do has many names. Depending on which field you are, neuroplastic, mind body. It used to be psychophysiologic disorders or psychosomatic disorders, you might have heard. Yeah. Both of those terms have the phrase psycho in it, even though that just means relating to the brain, that people were not responding well because psycho has a different connotation where people think you're thinking I'm crazy. And I have seen that a lot, like a lot of providers and a lot of normal people, like they think that if you have these problems that you're crazy, and that is just not the case. To be honest, the people I work with, really what I see is that these are such strong people who have been carrying immense burdens that most of us wouldn't even be belief, and yeah, so that's one thing is we gotta educate that it's a real thing, and it's a very common thing. It gets very, very common. We kind of think about short-term symptoms in this way. We believe it. For example, I'll use the example of stage fright. If you get on a stage and you have stage fright, you might feel your heart flutter. You might feel like your stomach is in knots. You might be sweating. All of these are physical symptoms, but that's not where the problem is, right? The problem is you're afraid on the stage. But for some reason, when that transfers over to chronic pain, we don't see that as much. So we don't see that chronic problems can be perpetuated by the brain. And I think part of that is the specialization of medicine. We're all so focused on our one body system, right? Sometimes we don't take a step back and see that there can be a problem in the stomach when there's nothing wrong in the stomach.
Yeah. If someone wanted to dive in like you did to learn more, where would you suggest they start?
Well, I have a website and I have a resources tab that I've kind of compiled all of my favorite resources. So shiftmindbodycoaching.com is my website. And that's kind of my favorite place to direct people because it has a few YouTube clips you can watch really quick, or books, podcasts. It's got also scholarly articles, because I'm one who I definitely want something to be evidence-based. And the work I do is it's not woo woo. A lot of people kind of think that, but it's very backed by science, that this kind of treatment actually works as well or better than any procedure does. So that's why I'd recommend. I mentioned the app called Curable is a really helpful tool. I'm a lifetime member. I bought a lifetime membership of that, and I still use it myself regularly.
Yeah.
So those are probably the two places I would send people.
Yeah. Do you still have any lingering effects from your health scare?
Yeah, I still do get chest pain when I get stressed out. So a lot of people will find that when they're telling you they get better. A lot of times it doesn't mean you never have a physical problem or symptom again, because we're all human, right? But the difference is I get stressed out. My heart starts feeling like sandpaper is rubbing against it. And I know that it's because I'm stressed out, and I know what I need to do. And it goes away within a matter of hours at the most, right? And so I've learned the tools where I can handle it. And that's kind of where people get to. And the longer and longer they do that, the less and less symptoms that they have.
Yeah. You've done the work. You've created the space, the knowledge to recognize what your triggers are. And I think that's an important point to make, that these things may not go away, but we create the opportunity to have awareness around them and then to move in a different direction, right? To retrain those thoughts that kept us there.
Yeah, absolutely. The awareness is like such a huge thing. Like so many of us, I myself, like completely unaware of what I was feeling, what was contributing to my own. You mentioned triggers. I have 4 of them, 4 little adorable triggers. They are, my kids are they're really, really smart, bright kids with strong wills, and I love them so much, but they are challenging. And so I did see an uptick of symptoms in the summertime. And I anticipated that would happen, but like I said, I'm equipped with the tools to do it, so it doesn't become a chronic problem again.
Wow. Yeah.
Speaking of the 4 triggers, I like to get a little personal, if you don't mind. So going back to pre-COVID, you had 4 kids under 10, you're married, you had a family, and you showed up in the world a certain way. And then through this experience, it seems to me that you've created a deeper awareness around the body-mind connection. And now you're out serving in the world. And now here you are a few years later, 3 years later, mom in the same family with 4 kids and the same husband. How do you show up differently in your family and in the world than you did before?
That is such a great question, because so many of us can't really necessarily get rid of all of our stressors and all of our triggers, right? I still have the same kids I did 3 years ago. So one thing for me that I was not aware of is how much before I parented with fear. Like I was so afraid in every way I approached parenting. It was a fear that my kids weren't going to turn out as functioning adults in real life when they grew up. And so I approached every interaction with each of my kids with the lens of fear. I had no idea how much fear-ridden I was. And so in going through all this work for chest pain, I learned that about myself. I learned that I have a lot of fear. And so now I approach it differently. In fact, I like the self-talk that I tell myself about my kids. My kids are masterpieces. My kids are going to be just fine. And I believe that. I really do. Whereas I didn't believe that before. And just that change has completely changed how I show up as a parent.
Wow, that's beautiful.
Wow. Great work. Thanks for sharing that with us.
It's fun. I could talk about it all day. I love it.
Yeah, that is, and you say you speak that language, right? And you believe it, right? Going back to your clients, your folks that you coach with, they ultimately believe it themselves when they start to change that language for themselves, right? You see that happening over and over again. And
it's really fun where they start to see a little progress, and then that gives them a little more hope, and then it gives them a little more. I'll be honest that probably the biggest thing that is keeping people from getting better is they just have to hold on to their diagnoses. They just can't let it go. And when you're kind of trying to play both sides and be like, oh, but there really is something wrong with me, but this and that, and they kind of vacillate, they're still holding on to that fear, and you're keeping yourself in fight or flight, always looking for threats. So for my clients, if they can just let go, the specific ones that I see a lot, fibromyalgia is one that they just can't let go. And migraines is another one. Anyway, once you kind of, you let go of that and realize, like, I have the cure is within me. I am the solution. And then just watching them soar has been really fun.
Wow.
Do you formalize that into language, declarative language, like instead of identifying, I am fibromyalgia, I am the cure is within me, and my body has fibromyalgia? Do you create declarative statements with your clients?
Yeah, and to be honest, for a lot of diagnoses, like I like to talk about, like, really just write that diagnosis down and then give it to me. I'll take it, because that one, for example, with fibromyalgia, that's just a collection of symptoms that, nobody has really been able to figure out, like, what is the root cause of fibromyalgia. And so it's just symptoms. And so just, like, let that go. That is not who you are. It is not something that will be with you all the time. And a lot of people have a hard time with it because they've had it for so long. They're like, this is how can it possibly? I've had it for 20 years, I've worked with people. My first client, even, I'll share about my first client real quick, had been in pain for 25 years. And severe stomach pain. She went to the ER several times a year. They did all the tests because she thought surely she must be dying because she was having such severe stomach pain. And we worked for, I would say, 6 to 8 weeks before her pain was gone, just in that amount of time. And that's not everybody's reality. But it sure gave me some confidence as a coach. And for her to see that, is that even though that had been a part of her life for 25 years, it didn't define her at all.
Wow. That's amazing. I love how you described, give that to me. Give me the diagnosis.
I'll take it.
That's just beautiful. I love that. So that's great. Jeff, what other questions do you have? Other things that are on your mind?
Nothing is really coming to my mind right now. This is a very powerful conversation.
Very much.
Up some really interesting things for us.
Yeah.
I think that, I'm all amped about this because I could talk about this all day, but I do want to mention, like, chronic pain is just devastating for people who are in it. It over encompasses everything in their life. It makes it hard to be happy. It makes it hard to have hope. And I've personally been there for a long time. I was, I never thought I would get better. I thought I would just wither away in bed and die. And so many people. So, as excited, I don't want to send the impression that I do not feel for these people and really have a lot of empathy for what they're going through. But I also just know that there's a lot of hope for them. And so if they can borrow mine until they get some of theirs. So,
Corey, I do have another question, if you don't mind.
Yeah, go ahead.
So we've talked about people who have had an actual physiologic condition, and via neuroplasticity, they've ingrained a cognitive behavioral pattern, or even when the structural problem is gone, they still experience the same pathways and the same pain. What about people for whom an actual physiologic or structural problem persists? Is there a way to downregulate it?
Yes, this work also works for structural issues. Like we talked about, dialing down the pain, anybody can do that. Pain is very subjective. And so fear is really good at amping up pain. And so for those people who maybe have structural issues, I'll use the example because you guys are, I think orthopedic, you probably have somebody who, lots of people who maybe total knees, right? You've got osteoarthritis in the knee, it's bone on bone. They walk, it's very painful for them. That's not neuroplastic. That pain is real. That pain is structural. But these kind of principles that we're talking about is not fearing our pain, meditation, journaling can maybe bring let's say your pain's at a 7, it can bring it down to a 4. It really can.
amazing.
Yeah, that's awesome. Well, I definitely feel the empathy from you for those folks. And I just want to acknowledge you for all the great work that you're doing and for being here to share your story and to share how you've used that to serve others in the world that can benefit from this sort of work. So thank you for sharing with us.
Well, thank you. And thank you both for what you're doing. I love the concepts that you guys advocate for in medicine. I feel like there's a lot that, needs to change, and a way to, to make our medical system where patients are seen and heard, and where doctors and nurses are seen and heard as well. And I think it's just really powerful. So,
well, thank you. We appreciate that. And
yeah.
Those listeners, what I loved about the conversation is get curious, find out more, listen, and explore what's going on for people and how they're showing up that way, and show up being non-judgmental and being open to hear and listen to what's going on for our patients and those around us, and just get curious about it. So thanks, Lindsey, for being on, and check Lindsey out at shiftmindbodycoaching.com. And thanks for listening. And thanks, Lindsey, for being here. It was great to have you.
Thanks for having me. Great to be here.
Absolutely.